So let's start this subject. So if you want to remember only one page from this lecture, I want you to take it. What does it mean? If you look at the diagram, right side of the face, right side of the thorax, and right upper limb. So it is colored with green color coded. They drain into the venous system, which is different from the rest of the body. So the left side of the head and neck, face, head, neck, and the left thorax, left upper limb, plus the rest of the body, they drain their lymphatic system, drain finally into the left side. So that is the difference. I want you to remember that the lymphatics for the right side of the face, right side of the neck, head and neck on the right side, upper limb, and right thorax, we go into the venous system in one different way, and the rest of the body, they have a separate way. So I want you to remember that. And the next, what is the lymphatic system? Lymphatic system, it just collects all the fluids and debris which are left behind from the arterial and venous system. They take it back to the circulation. So that is the job of the lymphatic system. So we remember our heart. The heart pump out the arterial blood into the arterial system and finally become capillaries from the arterial side, and then these become capillaries on the venous side and gradually become small vein, bigger vein, large vein, and then finally superior and inferior vena cava, and they drain into the heart. So when there is transferring becoming from arterial end of the capillaries to venous end of the capillaries, and there might be some fluid leak out from these capillaries, like excessive fluid will leak out into the environment, or sometimes like large protein will leak out from the circulation. But if the protein is large, and they might not be able to take it back through the venous system, then lymphatic system is just like a scavenger. Anything left behind, left over, it will pick up, tidy it up, and then drain it into the lymphatic system, and finally gradually come into the venous system. So they will put everything back into the circulation. That is the job of the lymphatic system. So 2 slides I want you to remember. This one, the job of the lymphatic system, it just carries any excessive extravasated fluid from the capillaries and the proteins back into the circulation. That is one. And number 2 is right side of the head and neck, right thorax, right upper lip. They go into the venous system in one separate way, and the rest of the body, they have their own different arrangement. So that is 2 important things about the lymphatic system. So let's keep on moving. And let's say this is the capillary region. Yeah, so this is the capillary. The cells lining the capillaries is called endothelium. So these are the endothelial cells. And there will be blood inside the capillaries with the RBC. Oxygen will be delivered to the cell. Glucose from this blood will be delivered to the cell. And the carbon dioxide from the cell, urea, the cell metabolic waste product from the cell will be taken back from the capillaries. So that is what they are doing. And if there is any leakage, any excessive fluid leakage around these cells, in between the cell, interstitial space, if there is any excessive fluid leak from the capillaries, lymphatic will take it back. So the heart, arterial system, venous system, the large elastic artery, for example, aorta, medium-sized muscular artery, for example, like radial artery, ulnar artery, or renal artery, and then finally become small artery, arterioles, and then gradually become capillaries, capillaries from the arteria end, and capillaries from the venous end, all these continuing, and the capillaries become, if you remember, continuous capillaries, fenestrated capillaries, or sinusoidal capillaries. So the larger the size hole, there is more leakage into the surrounding tissue. If these leakage, if they are not carried back by the venous system, the lymphatic will take it back and put it back into the circulation. That is the job of the lymphatics. So if you look at this diagram, the order of the lymphatic system, so it starts with the lymphatic capillaries, because the job of the lymphatic system is to collect everything left behind in the periphery cellular portion back into the venous system, systemic circulation. So which means like it is a one-way, it is not like a circulatory system. Circulatory system has arterial system from the heart to the periphery, and from the periphery to the heart is venous system. But lymphatic system has only one way, because it carries excessive fluid from the periphery capillary level back to the systemic circulation into the venous system. So it is a one-way, system. So it starts from the lymphatic capillaries, and then capillaries will become collecting vessels, and they will get to the lymph nodes. So capillaries will become lymphatic vessels, will go into the lymph node, one lymph node after another lymph node, and then once they leave the lymph nodes, they will become lymphatic trunk and finally become lymphatic duct. And this lymphatic duct drain into the venous system. So hey, it is a little bit wordy, but we get through that, yeah? So like in arteries, we know that elastic artery, medium artery, arterial, and capillary. The same thing, there is an order, lymphatic capillary to start with, and finally the final vessel is lymphatic duct. So don't worry about that, we'll go through that, but just keep moving. So the lymphatic system, it collects excessive fluid from the periphery, and it collects leak protein. So that's what we talk about. Yeah, so anything left from the drop off from the capillaries, from the arteria and vena end, the lymphatic will take it back and send it back to the systemic circulation. So return all these into the systemic circulation. The order is, they start from the lymphatic capillary. The capillaries become vessels, lymphatic vessels, and they will go to the lymph nodes, from one lymph node after another lymph node, after another lymph node might be one after another. After crossing the multiple lymph nodes, they will become lymphatic trunk. And trunk, finally, they will merge together to become lymphatic ducts. And that will go into the venous system. So that is the order. That is the start from the capillary. Finally, they become trunk. The capillary become vessel, vessel go into the lymph node go into the trunk, and trunk will merge together to form the lymphatic duct. So that is the order of the lymphatic system. If we go back to the previous page, we get that. So lymphatic capillary, lymphatic vessels will go into the lymph node, from lymph node to another lymph node. And then once they leave the lymph node, they will become lymphatic trunk, and trunk will combine together lymphatic duct, and that lymphatic duct will go into the large veins. So that is the order of the lymphatic system. And this is the job of the lymphatic system. Right, let's look at the capillaries area, capillary level. So this is the arteria end, capillaries. Gradually they change into venous and capillaries, and finally they become venous, small little veins called venous. And so they are meshed around the cell region, and if there is any fluid leak, excessive fluid leak, or or any protein left outside the capillaries, the lymphatic vessel, which are meshed with the capillary arteria and venous capillaries, they will just pick it up and then send it back to the systemic circulation. That is the job. Just a reminder of the capillaries, three capillaries you know. Number one is continuous capillaries. Continuous capillaries mean these are the flat, simple squamous epithelium cells, but squamous epithelial cell, but in blood vessel, we will call it endothelial cell. The flat, simple squamous epithelial cell in the heart, we will call it endocardium. So to say, so the endothelial cell, there is no significant gap in between one cell and another. The cell itself do not have any perforation, so they are continuous cells, and they are found in the skin, muscle, and the brain. Another type of the capillary, which is called fenestrated, which means the endothelial cell has small little punctures hole already. So the transfusion across the capillary is a little bit higher. So this can be seen in the kidney or small intestine, where the secretion, filtration, and absorption are more active. And this is like a big hole, big gap in between the cells, endothelial cells, big gap. In the endothelium, the perforations are much larger, and we'll call it sinusoidal capillaries. Sinusoidal capillaries, they are seen like freely crossing, big structures crossing the capillaries, which is found in the liver, bone marrow, and spleen. So three capillaries as a reminder. But lymphatic has slightly different capillaries. Although we call them capillaries, they are slightly different from the circulatory capillaries. Let's look at that. So if we look at that, this is the lymphatic capillary. So the green color is a lymphatic capillary. And as we know, lymphatic is a one-way system. One-way system means it will bring the fluid, excessive fluid and protein leak out into the surrounding tissue. It will carry everything back from the periphery back into the systemic circulation, which therefore it doesn't need to go anywhere. It just need to take it back into the systemic circulation, and therefore it is a one way. And therefore it starts with the ant blind pouch. Look at that. It is not continuous with another one. It starts with the ant blind pouch, and it will lead back to the systemic circulation into the big veins. So if we look at this diagram, you can see a flat green cell. Hey, what is this cell going to be? Of course, it is going to be a squamous epithelium, flat cell. But it is in a lymphatic vessel, so we get a little bit posh name, endothelial cell. Yeah, so capillaries, endothelial cell. So these capillaries, these endothelial cells, which are nothing more than the simple squamous epithelium. Look at that. The life is so simple, isn't it? If you want to make something cross, you just use a simple squamous epithelium. So this simple squamous epithelium, which is called endothelial cell, they are like a roof, it's just flapping on each other. Look at that. So this simple squamous epithelium is flapping on look at that, flap like mini valve. Oh, look at that. This one is lying on top of another, like our roof. And they are connected to the surrounding connective tissue via the filaments. Look at these little filaments. They come and attach to the little flaps of endothelial cell. What does it mean is if there is any fluid any changes in the surrounding tissue, these little filaments will contract, and this will open the leaflet flap, and the fluid from the surrounding tissue can go into the opened little flap. That is the way the lymphatics take it back all the fluid and large molecular weight proteins back into the lymphatic channel, and they will finally send it back to the systemic circulation. It's amazing. So these lymphatic capillaries, so what do we know now? What do we know about lymphatic capillaries? Number one, we know that they are blind pouch. That's number one. Number two, we know that they are only one way from the periphery to the center into the vein. Number three, they are linings of the capillaries are similar to the arteria or venous capillaries, which are flat, simple squamous epithelium, and we call that as a endothelium. And number four, they are attached to the surrounding tissue with the little filaments. And if there is any excessive fluid in the environment, these surrounding tissue will change position, and these little filament will contract. That will open the little valve-like leaflets, and then the fluid can go in. So that is what we know about lymphatic capillaries, which is the beginning of the lymphatic system. It is beautiful when you really understand. So lymphatic capillaries, they are lined by the simple squamous epithelium called endothelium, not a big thing, located close to the blood capillaries. Yes, they are all meshed up with the blood capillaries. They are highly permeable. Okay, now you tell me. And fine collagen filaments, these are those little filaments, anchor the endothelial cell to the surrounding connective tissue. And lymphatic capillaries carry large protein, bacteria, virus, malignant cell. So everything the blood vessel cannot take, the lymphatic capillary will take it. It is just like a scavenger. If there is anything dirty in our periphery portion of the body, excessive fluid, bacteria, virus, anything, the lymphatic capillaries will take it back and take it back to the systemic circulation. Hey, one thing to remember, guys, we do not have lymphatic capillaries in our nervous system, so brain and spinal cord, we do not have it. And anything hard, like bone, teeth, bone marrow, so they do not have lymphatic capillaries. Wow. Okay, so now I appreciate what is the lymphatic capillaries. And as we say, lymphatic system collect all the excessive fluid from the periphery and all the leak protein from the periphery, and they return via circulation. And this is the order. We have talked about the lymphatic capillaries already, and we are going to talk about the lymphatic vessels. Right, so let's talk about the lymphatic vessels. So lymphatic vessels, lymphatics for the gastrointestinal tract. Of course, every structure in our body except the brain, CNS, central nervous system, and the teeth, bone marrow, they do not have lymphatics. So the rest of the tissue in our body, we have lymphatics. So what about the lymphatics from the gastrointestinal tract? So they start with the little lymphatic vessels, which they call lacteals, L-A-C-T-E-A-L-S, lacteals. They start in the microvilli of the intestinal mucosa. And of course, because it is there, it will carry everything. So digest it, whatever food we eat, like fat, the lymphatics will take it. Arteria, venous, capillaries, they might not be able to take it because fat, protein, they are large molecules. These venous Venous system might not be able to take it. Yes, if they don't take it, lymphatic system will carry it, absorb the digestive fat and carry it to the bloodstream. And these lymphatics from the gastrointestinal tract, because they have a lot of fat, they look like milk, and they are called chyle. So that is the Greek word chyle. Chyle is the fluid, milky fluid that is called chyle. So that's the lymphatic system from the gastrointestinal tract. They start with the lacteals, absorb it, and then send it to the bloodstream. And I want you to remember chyle. Right, so lymphatic pathway, now we have talked about the capillary already. We talk about the collecting vessels. So all these small little lymphatic capillaries, they will combine, march together, one after another, one after another, one after another. So these lymphatic capillaries will combine together to become the collecting vessels. And when we talk about the vessels, superficial lymphatic vessels will follow the veins, and deep lymphatic vessels, they usually follow the deep arteries, because arteries are deeper. Brachial artery is deep here inside. Abdominal aorta is deep there inside. So deep lymphatic vessels will follow the arteries. Superficial lymphatic vessels will follow the vein. Instead, because they are just combination of the capillaries. So they are not a very big structure yet. They are thin wall, their walls are still thin, but they start to get tunica intima media adventitia. Tunica intima media externa. So they're like our blood vessels, tunica intima media adventitia. The same thing, tunica intima media adventitia. So although they are slightly larger than capillaries, these collecting vessels are still very thin wall, but they start to get 3 layers already. So as we know, if you don't know something, how many layers? We said 3. Intercostal muscles, 3 layers. Meninges, 3 layers. Abdominal wall muscle, 3 layers. Arterial wall, 3 layers. Intima media adventitia. Lymphatic vessels, 3 layers. Everything in life, 3. Okay, so starting from the collecting vessels, we start to get tunica intima media and adventitia. And lymphatic is a low pressure system, because artery is a high pressure system, because the heart is behind these vessels and it is squeezing and pumping out with such a big pressure. Venous system is a low pressure, because it starts from the periphery, come back to the heart. There is no heart in the periphery. So the vein is low pressure system. And the same thing, the capillaries, they start from the periphery, come back to the heart. So therefore it is like a venous system, and it is a low pressure system. So how can this fluid, lymphatic fluid, from the big toe, from the little toe, can come back up against the gravity along the body into the heart, into the blood vessel? So yes, the same thing like venous system, because the muscles around the lymphatic vessels contract, so they will squash the lymphatic vessels, that will push up against the gravity. And like the venous system, they also have multiple valves, so that it becomes one way. When it goes up, it just stays there. And the nearby arterial pulsation, boom, 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 that will push the lymphatic vessels, lymph in the lymphatic vessels up against the gravity and tunica media, muscle layer of the lymphatic vessels. They will just contract. So it is very much like a venous system for the transport of the lymph from the periphery back to the systemic circulation. So now from the capillaries, we study a little bit about the collecting vessels. And now we get to the lymph nodes. So lymph nodes, they are like a kidney shape. That's what they say. It's not like a little circular structure. It is more like a bean structure, red bean, kidney bean. It might be about 1 millimeter to 25 millimeter. So less than one, very small, little tiny lymphatic vessels, less than 1 millimeter to 2.5 centimeter. It is a site, lymph nodes are the site where the lymphatic vessels arrive. At the same time, the immune system gets into play. So it is an intersection for lymph node is important for both lymphatic circulation from the periphery as well as the immune system. As like everything, like it has got cortex and medulla. Like kidney, we have cortex and medulla. Adrenal gland, cortex and medulla. The same thing, lymph nodes, we have cortex and medulla. Hey guys, here are a few little important things about the lymph nodes. Because everyone must have felt lymph node in our body at one point or another. So where do we look at that? So the lymphatics from the head and neck region, so face, head, and neck region, they were drained to the superficial cervical lymph node. So around the neck, around the sternocleidomastoid muscle. So if we feel a lymph node in the sternocleidomastoid muscle, we have to check the head and neck and the throat, neck. That is the importance, because if there is any cancer in the oropharynx, nasopharynx, we cannot easily see they present with the enlarged lymph node in the neck. So if you see any superficial cervical lymph node enlargement, you will be looking at head and neck region, looking for any malignancy, cancer, or infection. So that is what we need to check. That's the importance of the lymph nodes and lymphatic drainage. If we see any enlarged lymph node in the axilla, we need to check the upper limb. If we see any enlarged lymph node in the inguinal region, in the groin, we need to check the lower limb. So, because if there is any infection in the lower limb, it will drain into the superficial inguinal node or in deep inguinal node. So if you see the lymph node enlargement, you need to know where they are draining from, and you need to check there. Because like any enlarged lymph node could be either infection could be virus or bacterial infection, or this enlarged lymph node could be secondary to malignancy, cancer. Therefore, the enlarged lymph node is really important, and you need to know where the lymphatic is coming from to that particular group of lymph nodes. If there is any mediastinal lymph node enlargement, we need to check the trachea or bronchus, tracheobronchial tree inside the mediastinum structures. We need to check that. Aortic node, so that's along the abdominal aorta, aortic lymph nodes. We need to check the posterior abdominal wall, hey, posterior abdominal wall, and the testes and the ovary. So this ovary and testes, gonads, they are originally intra-abdominal organs. And as the body grows during the fetus life, these organs gradually descend into the scrotum. And therefore, if there is a testicular cancer in the testes, it will drain into the aortic lymph node. So that is really difficult to appreciate, because aortic lymph nodes are really, really deep. So who is going to be able to feed the aortic lymph nodes? So difficult. So, but that's what we need to check. We have to do a CT scan for the abdomen if we suspect the testicular cancer. If there, for these organs in the pelvis, so like uterus, ovaries, bladder, so we need to check the iliac nodes. Of course, iliac node will gradually go into the aortic nodes. So that is the reason, the lymph nodes and their draining region is important, because it is all about not missing any major problem. The major problem means infection and cancer. So if we miss, that is a big miss. So, hey, little lymph node in the neck. What's that? Hey, it doesn't really matter. No. You have to check the head, you have to check the neck, especially in the oropharynx, because the superficial cervical lymph node will receive all the lymphatics from the head and neck region. So lymph nodes are important. Hey, look at that, like a kidney shape, like a kidney, yeah? Kidney being kidney. And you can see the capillaries will be here, and then lymphatic vessels will be here. These lymphatic vessels will be draining into the lymph node from the cortex portion. So these are the lymphatic vessels draining into the lymph node. You can see the valve here draining into the cortex portion. So this is the cortex portion, and the inner side, outer side is cortex, inner side is medullary portion, medullary cord, medullary sinuses. So all the lymphatics we have to go through from the periphery into the center, more into the center, after going through the different levels of filtration. So the lymph nodes is going to filter everything the lymphatic vessels taking. So lymph nodes will check any protein, lymph node will check any bacteria, lymph node will check any virus, lymph node will check any malignant cell. Therefore, the lymph node enlargement is important. It might be nothing, it might be just like a little viral respiratory tract, upper respiratory tract infection, could be, or it could be something serious. And therefore, enlarged lymph node, we have to take it seriously. So this lymphatic capillaries here will become lymphatic vessels here, come into the lymph node from the cortical portion, gradually filter and filter and filter again inside the lymph node. And finally, once they are really clear, they can come out through the hilum. This area is called hilum, so which is all the lymphatic vessels leaving the lymph node, and they are called leaving, so they are efferent lymphatic vessels, coming in efferent lymphatic vessels and leaving the lymph node along the efferent lymphatic vessels. Now they are already filtered and they are clear, they are good to go, and the lymph node will let them go through the efferent vessels. So now we have and look at that, the outer cortex, the capsule here, very outside, which is a fibrous tissue covering the lymph node, will come into the medullary portion. That is what we call trabeculae. So that is not a big thing to remember. From the capsule coming into the medullary side, that is called trabeculae. And this is the photomicrograph, which is pretty cool to look at. If you look at that more. So these are the reticular tissues in the medullary sinus. What do? They do the filtration function, filter the lymph they carry. So the lymphatic capillaries will carry everything, anything, and can become a lymphatic vessels. Vessels will come into the lymph node. Once they get into the lymph node, this lymph node will filter the lymph at all costs. You know, this malignant cell, bacteria, virus, protein, they will all get filtered in the lymph nodes. Look at that, there is a macrophage as well. Macrophage will just detect everything. And when we say that the lymph node, the draining region of the lymph node is important, because if one can feel lymph node in the axilla, we need to check the upper limb. Of course, you know, the upper limb will go to the axillary lymph node. The same thing, the breast, lymphatics from the breast will go into the axillary lymph node. So axillary lymph node enlargement, you got to take it seriously. So it might be infection in our finger, and that infection will drain along the lymphatics into the axillary lymph node. Or if for somebody, they might have breast cancer, and that breast lymphatics will go into the axillary node and present with the axillary lymph node enlargement. They cannot feel anything in the breast, but they can feel something in the axilla, in the armpit. Hey, what is that? Hey, that's an enlarged lymph node. Where is it coming from? Might be from the upper limb. Check your upper limb. And then they do not have any problem. So check the breast. So that's the way, you know, the lymphatic drainage and their associated lymph nodes are really important. So if you look at that, where are the lymph nodes in the axilla? Hey, these are the lymph nodes in the axilla. This is the pectoralis minor muscle, which you know. And here I want you to introduce serratus anterior muscle, serratus anterior muscle. This serratus anterior muscle, as you can see, it is covered underneath the pectoralis minor, and on top we have the big pectoralis major. But actually, they are originating from the ribs, lateral portion of the ribs, and it is going to the scapula. So that is a muscle called serratus anterior. Why do they say serratus? Oh, hey Amanda. Amanda, did you want to say anything?
Oh yes, I have a quick question.
Yeah.
Are we able to feel our lymph nodes if they're normal size?
It is difficult. It is difficult because the superficial lymph nodes, you know, here and there, sometimes we can feel it, but once they are easily palpable, then we have to suspect something. So in our groin, you know, inside our groin, sometimes we can feel very small, like a little bubbles in our groin, small lymph. That is normal. That is normal. But let's say if they are slightly larger and if they are too easy to feel, then we have to look for something.
I have a question about that.
Okay.
When my daughter was born, she had a lump on the back of her head. It was a little bubble, and they said that was a lymph node, but that it was normal.
Yeah.
So it's atypical to feel them when they're normal, unless they're oddly placed.
Yeah, so that is like what we call is in the occiput, so occipital lymph nodes.
Yeah.
So in children, you know, because kids are different, their immune system is so strong. So with little anything, they will respond. So yes, I mean, it's something to keep an eye on. But in kids pediatric group, they respond very excessive way. Their immune system is so strong. But let's say if there is any enlarged lymph node, then we need to check. Make sure we check properly. So let's say in adults, this posterior occipital node, we should not be able to feel it. In the axilla, we should not be able to feel it. Unless, you know, we like, if you, like for the surgeons, breast surgeons, we always try to feel the axilla. I mean, we can feel it, of course, if we are trained to, but they are not enlarged. So if we feel something lymph node enlargement, we need to check. Number one, infection. Like in children, little virus infection can give them like a slightly enlarged lymph node here and there. As long as we know it is virus, that's fine. So any enlarged lymph nodes, it need to be checked out carefully. All right, so this is the pectoralis minor. And you can, if we remove the pectoralis minor, hey, where is it? The pectoralis minor has been, we can see the big muscle, which is originating from the ribs on the lateral aspect, going to the scapula, So that is what we call serratus anterior. Serratus mean in Latin, like it is just like a sawtooth. It's just like boom, 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 boom. So that is serratus anterior muscle. I mean, the job of the serratus anterior is I stretch your leg and then pushing forward. That is the job of the serratus anterior muscle. So that is the job of this. So if you have to push your car because your car doesn't start, then that is the muscle you are using. That is the serratus anterior muscle. Because it is attaching the thoracic wall and it is attaching the scapula, it stabilizes the scapula in its position. So if there is any problem with the serratus anterior, when you push and stretch your hand and push it, the serratus anterior doesn't function and the scapula will twist and turn, and that's again winging off the scapula. Okay, anyway, what I want you to remember is serratus anterior muscle, which is on the lateral thoracic wall from the ribs going to the scapula. The job of the serratus anterior is you push something like that with your arm straight and you push like you're pushing your car because the car doesn't start. But what is more important here is the pectoralis minor muscle, the lymph node group, which is in the axilla here, just lateral to the pectoralis minor, just underneath the pectoralis minor, and just medial to the pectoralis minor. That is really important because in breast cancer, if the lymph node spreads to this node, the staging change. That means there is a metastasis into the axilla. So the stage, like stage 1, 2, 3, 4, that stage change, and the operation we need to do also change. If the lymph nodes here are clear, then we can just concentrate on the breast. If the lymph nodes here got some cancer cell, we have to follow there into the axilla, and we have to remove the lymph nodes in the axilla. What does it mean? Because we are removing the lymph node in the axilla, that means the lymphatic flow from the arm, which has to come back here, they cannot come back here anymore because we have damaged the lymph node with the surgery. And therefore they can get lymphatic edema. So the swelling, the fluid, excessive fluid from the arm cannot come back to the body. So that is important. So that is important. So anyway, what are we talking about? We are talking about the lymph nodes. Lymph nodes, you need to know the draining region of the lymph node, and any lymph node enlargement, just a little bit mindful. Yeah, don't get over anxious, but just a little bit mindful and check and think what it could be, where is it coming from. So that's what we need to do. Of course, sometimes, we don't really know and there is no good reason. That's fine. As long as we are cautious, we have a thinking mind, we are fine. Right, let's move on to end. Okay, the next thing is, here the nerve, the brachial plexus are very close to the lymph nodes here. And therefore, trying to take the lymph node from here is also can damage the nerve. So it is not easy. Right, so we talk about lymphatic capillaries and then collecting vessels and the lymph nodes. And now everything from efferent lymphatic vessels leave the lymph node from the hilum, and they will all join to form lymphatic trunk. Hey, this is a little bit difficult. I cannot remember at any time, because I have to go back and read. So I do not expect you to remember straight away, but it is good to know, good to remember. So all the lymphatics in the lymphatic trunk, all the lymphatic vessels in the lumbar region, they will all bind, become aorta, abdominal, pelvis, lower limb, they will all combine together. From the intestine, stomach, intestine, digestive tract, all along, they will combine together. Inside the thorax, from the mediastinum, heart and lungs, they will all combine. In the neck, upper limb, upper thorax, they will combine to become subclavian. Trunk, not trunk, lumbar trunk. So all the lymphatic vessels around the aorta, abdomen, pelvis, lower limb, they will become lumbar trunk. The stomach, intestine, digestive tract, they will become intestinal trunk. Bronchia, so lungs and mediastinal structures, they will become bronchomediastinal trunk. From the neck, upper thorax, upper portion of the thorax, upper limb, they will combine together to become subclavian trunk. Of course, you know subclavian vein. So this is subclavian trunk. Of a head and neck region, jugular vein, so they will become jugular trunk. So all the lymphatic collecting vessels after leaving the lymph nodes, they will combine together to form a lymphatic trunk. Look at that. That is everything now finally combined together to form the lymphatic trunk. And as you can see, the right head and neck, right thorax, right upper limb has one way, and the rest of the body has a different way. So then find these all lymphatic trunk will finally combine together to become lymphatic duct. Hey, that is one lymphatic duct we need to remember at any time, even at the middle of the night. Let's say if you're sleeping and if I wake you up at 2 o'clock in the morning, hey, what is this? This is the thoracic duct. So thoracic duct, which is really important. We cannot forget that. So thoracic duct, where does it begin? So where does it begin? Let's just look at back here. So here we can see a structure called cisterna chyli, which is the little bulgy lymphatic structure. Cisterna chyli is the beginning of the thoracic duct. So cisterna chyli is the formation of between lumbar lymphatics and intestinal lymphatics. So everything inside the abdomen, let's say all the intestinal contents from the stomach, small intestine, large intestine, all the lymphatic draining, passing the lymph nodes, and the posterior abdominal wall, lumbar lymphatics, they will all march together and form at this little bulge. That little bulge is called cisterna chyli. Cisterna chyli is the beginning of the thoracic duct. And it gradually, if you look at that, this cisterna, the everything lymphatic from the lumbar, lymphatic from the intestine, they were all by. They will become a little bulge, like a little pool, and that is called cisterna chyli. And if you look at that cisterna chyli, they will continue as a thoracic duct. Look at that thoracic duct. Let's follow the thoracic duct. It is starting from the right side, and it is crossing the midline, and it is crossing to the left side. And finally, this thoracic duct will go into the junction between the left internal jugular vein and subclavian vein. That junction here, this thoracic duct will drain into. Junction between the internal jugular vein and left subclavian vein. So that is the beginning of the thoracic duct, which start as a cisterna chyli, which is secondary to the combination of margin between the lumbar and intestinal lymphatic systems. And that will finally drain into the left subclavian internal jugular vein junction. And this is called thoracic duct. This thoracic duct is important. And the right upper quadrant of the body, will form into right jugular, right subclavian, right bronchomediastinal tract, and they will independently, just subclavian will come, they might combine or they might not combine into the large neck veins, into the neck vein. So right jugular vein will go into one of the neck veins. Right subclavian lymphatic tract will go into the neck vein. Might be combination, might be, it doesn't really matter. They just go into the right side of the veins. And sometimes they do join. That is called right lymphatic duct, which is short, not as important structure. But thoracic duct is really important. I want you to remember where it starts and where it ends. It starts as a cisterna chyli, which is in the abdomen, which is the combination of lumbar and intestinal lymphatic tracts. They all march together to form a little bulge, cisterna chyli. That cisterna chyli will come from the abdomen, gradually pass to the left side, finally drain into the junction between the internal jugular vein and subclavian vein. That is important. Thoracic duct. Look at that cisterna chyli. Look at that cisterna chyli. Cisterna chyli here. That's a combination of intestinal lymphatics and the lumbar lymphatics form a little bulge that is called cisterna chyli. Just run along here, gradually turn towards the left side, and go into the junction between the internal jugular vein and subclavian vein. Look at that. This is called left on the left side, left innominate vein, right innominate vein, and then they finally become superior vena cava. So that's why if you want to put a long line, into the vein, you can choose the jugular vein or you can choose the subclavian vein, but we would prefer to do it on the right side, not on the left side. Why? Because the deep venous access, like a large vein into the here, they can damage the thoracic duct, because if we damage the thoracic duct, it just leaks on and on and on and on, and it's non-stop. It is not like the chyle or lymph is not like the blood. Blood has got clotting factors and platelets, and blood can clot. But lymphatic is so annoying, it doesn't stop. It just keeps leaking, and therefore we prefer to avoid that. Therefore, like a long line for the chemotherapy long line, we prefer to use it on the right internal jugular or right subclavian, No, on the left side because of the thoracic duct, which is very closely related. We want to avoid that. Let's look a little bit more carefully about the cisterna chyli. So that is the combination of intestinal trunk and lumbar trunk. Where is the lumbar trunk here? Lumbar trunk, intestinal trunk, they will all march together from the right lumbar and left lumbar and intestine. They will all march together to form a little bulge of lymphatic structure vessel, which is called cisterna chyli. And this cisterna chyli will continue as the thoracic duct. So let's say if there is any blockage, in the lymphatic system, starting from the lymphatic capillaries, then lymphatic vessels, then lymph nodes, then lymphatic trunk, and then lymphatic duct. So if there is any blockage in this lymphatic system, what is going to happen? Of course, the excessive fluid leak out from the capillaries, arterial and venous capillaries cannot be returned to the systemic circulation. The protein which has left behind from the arterial and venous capillaries cannot be returned to the systemic circulation. And there is a backward pressure in the lymphatic system. And this is what we call lymphedema. Edema, which is secondary to blockage of the lymphatic system. So I said lymphedema. It is very particular. The lymphedema means edema secondary to blockage of the lymphatic system. Where there is another issue called chest edema, 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 edema. What is edema? Because it is excessive accumulation of fluid in the interstitial space. It could be like heart failures. If someone has heart failure, the heart cannot pump properly, and there is a backward pressure, and pressure in the big veins increase, pressure in the veins in the arms and legs increase, pressure in the inferior vena cava increase, pressure in the inferior vena cava increase. So there is a backward pressure, and the veins cannot carry fluid because of the pressure, and that is different from lymphedema. This is the problem with the lymphatic system, and you can see, it is more of a unilateral problem. So because if the cancer and axillary lymph node dissection in the axilla, it's only on the one side usually, or in the groin, do the operation on the groin lymph node, it's one side usually. And usually, therefore, the lymphatic edema is more of the unilateral. Look at that, which gradually get bigger and bigger and bigger and bigger. And their fluid is really tight. And therefore, if you push, you cannot see the pitting on the limb. So that is really sad condition. Of course, this condition is caused by the gynecologic malignancy. So there must be problem on the left side, and they have done the operation on cancer cells blocking the lymph nodes, and therefore, the left leg is swollen. So it is very sad. So lymphedema can be primary or secondary. Primary is very rare. Primary is like usually congenital. Congenital means that person is born with that problem. They do not have appropriate or proper lymphatic system. So some of the lymph nodes are blocked, some of the lymphatic vessels are not functioning properly. So they are born with that. That is what we call primary lymphedema. And secondary lymphedema is after something. Like for example, the surgery, like they said, the breast cancer patient, 2 out of 10, so 20% of the breast cancer patient, we have secondary lymphedema. So because the breast lymphatic will go to the axilla, that we block the axillary lymph nodes, to the fluid from the arm cannot come back to the axilla. So if vulvar cancer, 50% of the patient, it is very sad, like 1 in 2 patient is going to get this problem. On top of the cancer, they have this sort of problem. It is really sad. 1 in 2 patient, 5 in 10, so vulvar cancer. Like the cancer in your private part, is how annoying is it? On top of that, after many problems, it's really depressing. And penis cancer, penile cancer, like 30%, 3 in 10 patient will get lymphedema. So hey, just to be mindful, the lymph nodes and its draining region. Okay, so before you take a break, you can see a lymph node here, enlargement in a male adult, because the beard and mustache, we can see that on the left. So in the neck lymph node enlargement, which area are you going to check? So there is a clavicle here. This is above the clavicle. So this is what we call supraclavicular lymph node enlargement. So where is the draining region? Yes, I can see the hand here. Amanda or Arturo?
Is it the head and the neck?
Yeah, head and neck, on the left side of the head and neck, because it is on the left side. Very good. It's because usually, if we see these patients, the usual story is they do smoke. They have poor oral hygiene. They are a little bit more not health conscious. And they come with the, hey, I got a bump here. Look at that. Open their mouth. There might be some like tooth infection, like tooth decay, or more seriously, you have to look for any signs of malignancy. So usually they will be referred to the ear, nose, and throat surgeon to check up. Hey, go and check. But that is the okay, so let's take a break. So we meet about 1:15. So let's move on. So lymphocytes are subtype of white blood cell. How many white blood cells do we know? Of course, we know 5. Never let monkey eat banana. Never neutrophil. Let lymphocyte. M monkey, M monocyte, eat eosinophil, banana basophil. So basophil is the least common. Neutrophil is the most common. Neutrophil and basophil on the opposite side. But if we want to say in a different things, the granulocytes and agranulocytes. Yeah, agranulocytes and agranulocytes. Of course, B lymphocytes is the agranulocyte. Yeah, so lymphocyte, underneath the lymphocyte, we can divide into T lymphocyte, B lymphocyte, and natural killer cell. Hey, natural killer cell, what is it? This is never heard of that. Fine. So B lymphocyte and T lymphocytes, they are more important. And of course, natural killer cell is also important. So just try to remember natural killer cell B and T is under the lymphocyte. So lymphoid organs, what is the lymphoid organs? Lymphoid organs are those structures inside our body which we store or which we generate lymphocytes. These are the lymphoid organs. So we can see that bone marrow, yeah, they said it need to be red marrow, not yellow marrow. Red marrow, thymus gland, our tonsils, our lymph nodes, our spleen, appendix, some lymph nodes which are aggregated around the intestine, or the intestinal lymph node. They are all lymphoid organs because they store the lymphocytes or they generate lymphoid tissue. But we will divide into lymphoid organs into primary lymphoid organ and secondary lymphoid organ. Primary lymphoid organ and secondary lymphoid organs. Primary lymphoid organs are only two. They are thymus and bone marrow. So what is the difference between primary lymphoid organ and secondary lymphoid organs? Primary lymphoid organ will either generate or will either the lymphoid tissue will mature in these organs. Secondary lymphoid organs, they will store the lymphocytes. Therefore, the difference between primary lymphoid organ and secondary lymphoid organ is the primary lymphoid organ, they will either generate, for example, like bone marrow. Bone marrow will generate lymphocytes. Therefore, it is the primary lymphoid organ. The thymus, the T lymphocyte we have to go to the thymus gland for education. Therefore, T lymphocyte, thymus gland is important for T lymphocyte to mature, and therefore it is included in the primary lymphoid organ. The bone marrow, B lymphocyte will get mature and educated in the bone marrow. Therefore, B lymphocyte. Bone marrow is for primary lymphoid organ. Secondary lymphoid organs, they will just store the lymphoid tissues like lymph nodes, tonsils, spleen. They will not generate, they will not educate lymphocyte. They will only store, and therefore they are called secondary lymphoid organs. Primary lymphoid organs and secondary lymphoid organs. Primary lymphoid organs, bone marrow and thymus. Secondary lymphoid organ, spleen, lymph node, tonsil, small intestine, appendix. Secondary lymphoid organs. So infection and antigen. Of course, infection is also antigen. Antigen is any foreign material will be regarded as antigen in our body. Body defend with the macrophage and lymphocytes. Each lymphocyte recognizes and attacks the specific, very specific antigen. Therefore, lymphocyte, B lymphocyte, T lymphocyte, they are under the specific defense mechanism. So what is an antigen? Antigen is anything like protein, glycoprotein, in bacteria, cell wall, foreign plasma membrane, anything which is foreign, non-self. So if it is anything other than you, it is foreign, and that is the body will regard it as antigen. Lymphocyte, 3, T, B, and natural killer cells. So T lymphocyte, I believe we have seen this diagram when we are studying the hematology, the blood. T lymphocyte and B lymphocyte. T lymphocyte will go and bind the invading organism or the target cell, and then they will go and stimulate, where is it? They secrete the protein that lights the cell membrane, and then gradually the T lymphocyte will leave it, let the target cell to disintegrate through apoptosis. That is the job of the T lymphocyte. Go and attach to the target cell, just leave it, stimulate it, this target cell will disintegrate via apoptosis. B lymphocyte, the difference is B lymphocyte will change into plasma cell. Plasma cell will secrete many antibodies, which will go and attach to the antigen. The bacteria is antigen, virus is antigen, foreign protein is antigen. And then this surface antigen, and finally macrophage, we come and clean the antigen antibody complex. That is for B lymphocyte. Yeah. So B lymphocyte, T lymphocyte, they have different function. That's a so T lymphocyte, right, to the target cell, and then they just bind the antigen, and then they just leave it, let it go. This target cell will disintegrate. That is the T lymphocyte. B lymphocyte, they will change into plasma cell. Plasma cell will secrete multiple antibodies, which will go and attach the antigen, which is, for example, bacteria, and the antigen antibody complex will be cleared by the macrophages. Natural killer cell, now we tell. Natural killer cell, they do not recognize any specific antigen. They act when there is no self. They act as T cell. So they will behave as T cell, but they do not have anything specific antigen, because T lymphocyte has specific antigen antibody, but not with the natural killer cell. And if they think it is foreign, when there is no self, then they will go and attack. That is the natural killer cell. Again, like, you know, our bone marrow will generate B cell and T cell. B cell will remain in the bone marrow and get mature. T cell will have to go to the thymus gland and to get mature. And T cell will function as T cell, and B cell will change into the plasma cell, which will secrete antibody. Yeah. So T cell and B cell, that's the difference. They both originate from the bone marrow, but to become T cell, they have to go to thymus. To become B cell, they will remain in the bone marrow. That is the B cell and T cell. So T cell, you know, if you differentiate T cells a little bit more, we will see cytotoxic T cell, helper T cell, and of course B cell, natural killer cell, and there is memory cells. So this is a little bit more than the anatomy. Lymphoid tissue is a specialized connective tissue which contains lymphocytes. So any tissue that contains lymphocyte is lymphoid tissue. So that's why, you know, appendix became lymphoid tissue. The reason is appendix has got the lymphocytes. So appendicectomy, removing the appendix, yes, there is some drawback, but hey, when it is inflamed, just remove it. So lymphoid tissue, they were also present in the intestinal mucosa. So mucosa, that is what we call mucosa-associated lymphoid tissue. As we say, lymphoid tissue means any structure that contains the lymphocyte, and in the intestinal mucosa, these intestinal mucosa also contain lymphocyte, and therefore we will call it mucosa-associated lymphoid tissue, MALT. So this will be a little bit important, you know, when you, I just want you to hear about that. I just want you to remember, along our intestine mucosa, there are lymphoid tissues, and they are called MALT, M-A-L-T. Because sometimes, you know, for lymphoma, these can happen, like lymph node enlargement, lymphoma, lymph node cancer. So MALT. But at this stage, I want you to remember MALT, mucosa-associated lymphoid tissue, which are the lymphoid tissue along the intestinal mucosa. Lymphoid organ, primary lymphoid organ, secondary organ, bone marrow and thymus, lymph node, any secondary lymphoid organ, anything which contains lymphocyte, MALT. Oh, a little bit about thymus, guys, before you leave, a little bit about thymus gland. The thymus gland, what we know about thymus gland is in the mediastinum. It is behind the sternum. It educates the T lymphocyte, bone marrow lymphocyte. We have to come to the thymus gland, and thymus gland will make them mature and program to become the T lymphocyte. It contains multiple lobules. Hey, look at that lobules. One lobule here, another lobule here. It has got outer capsule, outer cortex, and inner medulla. That's easy to remember. It will contain thymosin, thymopoietin. Forget about that. It's just for completeness. And it is also contain epithelial reticular cells. The important thing is thymus gland change with age. So once we get older and older and older, the thymus gland gradually regress. So the best time for the thymus gland might be like 16, 18, 20. That might be the best time, the most developed part of the thymus gland. After that, the thymus gland will gradually smaller and smaller and regress. This is where the thymus gland is, in the mediastinum, behind the sternum. Spleen is also a lymphoid organ because it contains and it stores lymphocyte. Therefore, we need to talk about that. But spleen is a secondary lymphoid organ. It is not a primary lymphoid organ because to call as a primary lymphoid organ, it needs to generate lymphocyte or it needs to educate lymphocyte. Spleen does not generate lymphocyte. Spleen does not educate lymphocyte. Therefore, it is only the secondary lymphoid organ. The job of the spleen is to remove the antigen from the blood, remove the aged, the RBC lifespan. We said RBC, one RBC will last about 120 days roughly. So if they are all RBC, like 110 days old RBC, or damaged or defective RBC, the spleen will clean up. Spleen has white part and red part. Red part is for blood, red blood, dispose one out blood, and white part is for immune. So that's the way I try to remember. Red part, red blood for the one out blood, white part is for immune system. This is the spleen. Look at the splenic artery, which is very big artery, large dilated tortuous artery going to the spleen, which is arising from the celiac trunk. Celiac trunk is the first unpaired blood vessel from the abdominal aorta. It is going to the spleen. Hey, if you split the spleen, you can see the red part here, red part, and the white part. Red part, where is red part? This is red part. White part is here. White part is for immune, cleaning, clean, white. Red part is for blood. Blood means just clean the damaged blood, red blood cell. Yeah, so red part and white part for this spleen. Tonsils, like we talk about the nasopharynx, nasopharyngeal tonsil, palatine tonsil, lingual tonsil, and tubercle tonsil when we talk about the respiratory tract. So these are the tonsils. Tonsils are lymphoid organs, not primary. They are secondary lymphoid organ because they store only lymphoid tissue. They do not generate, they do not educate. Therefore, they are not primary. They are secondary lymphoid organs. Okay, this is the gland penis cancer. So cancer of the gland penis. So where do we need to check? So gland penis, the lymphatic drainage, they go to the deep inguinal nodes. So it might not be able to feel it inside our groin. But let's say for the scrotum will go to the superficial inguinal node. and then might be deep inguinal node, and then gradually progress upwards. So just a little bit careful, because we have a cancer here, somebody has a cancer here, but we might not be able to feel the lymph node because it is a deep inguinal node. It is pretty deep, which we might not be able to feel it. So what about the vulvar cancer? Vulva is equivalent to the scrotum, and therefore the, the lymphatic drainage will go to the superficial inguinal node first. They might go to deep node, but they will also go to the superficial inguinal node. From superficial inguinal node, they will go to deep node. From deep inguinal lymph node, they will go to the pelvic nodes, nodes inside the pelvis. Therefore, the vulvar cancer, we should be able to feel in our groin. And once they go into the pelvic nodes, they are stage 4 already. When they are in the superficial node, they are stage 3. So the different difficulty of treatment by stage. Okay, if we see in the neck, superficial cervical lymph nodes, then we need to check the head and neck. And in this patient, he has a tumor inside the left hemisphere. So if we see something lymph node, just check it properly. And this is the breast. Breast lymph node will go to the axilla. The lymphatic from the hands and fingers will go to the axilla. So axilla, we got to check it properly because the breast lymph node is draining into the axilla. Right. Okay, has anyone got any question? Amanda?
Yes, just a quick question. If your lymph nodes are swollen, how long, if it's from like a bacteria, like virus, you're sick, how long does that typically last versus something that's maybe more serious?
So the like inflamed lymph node, which we call lymphadenitis, so inflammation of the lymph nodes, we call lymphadenitis. So the possibility, number one, bacteria, virus infection, or number two, it could be from malignancy. So usually, like as Michelle said, like the occipital lymph nodes in pediatrics, usually they are virus infection, not significant. They will go away quick. Once the virus infection gradually gets over, like after 3-4 days, they will go quick. Bacteria infection, like if I have an abscess in my finger, and if my axillary lymph nodes are enlarged, and if I treat the abscess, once the abscess has been treated, you will start to see the progress. The painful enlarged lymph node will gradually become less painful, get smaller. So they will respond to the treatment very quick. So when it comes to the cancer, usually they are not painful because it is not infection, it is not inflamed, it is just enlarged because of the malignant cell. Hey, then they might never go away. So we have to treat the malignancy and we have to take them out. So it depends on the cause. So little virus infection, especially in children, they will just respond. Once the virus gone, they will get better. Bang, that's job done. Bacteria infection, treat the bacteria infection, this will get better. But for malignancy, they might never go away, which we might have to remove it. So it depends on the cause.
Okay, thank you.
And don't forget which area drains what. So the head and neck, the lymph node will come into the neck, cervical lymph node, superficial cervical lymph node. It's so easy to feel it. And let's say, for those people who has upper respiratory tract, virus infection, upper respiratory tract, tonsillitis, they might get this lymph node enlargement. Hey, one thing I forgot to mention, like multiple lymph node enlargement, it is called cancer of the lymph node, which is what we call lymphoma. Again, that is another serious problem. Or the leukemia, like a bone marrow cancer, leukemia, they don't usually present with the lymph node, but sometimes they do, like a little bit of lymph node here and there, but not as big as the lymphoma. Lymphoma is the lymph node cancer. That is like multiple enlarged lymph nodes. So lymph node enlargement, a little bit cautious, but of course, as long as you know the cause, you are cool with that. Hey, it is virus infection. Forget about that. That's fine. Hey, a little bit of tonsillitis, enlarged lymph node, fine. And if you see something, you need to, let's say in the exam, like when it comes to the clinical exam, what I get is I was asked to examine somebody's groin. Yeah. So when I feel the groin, so that only little groin area is exposed, and the examiner asked me, "Can you feel it?" I feel, look at it, then feel it. I can feel the lymph node, and the patient is a little bit painful in the groin. So enlarged lymphadenitis. And the examiner asked me, "What do you want to do?" So I said, "I want to check the lower part of the leg, and I want to check the external genitalia." Okay, good boy. Let's go to the next case. So that's the way they examine. So draining region, we need to know. And spleen, a little bit of spleen, red part, white part. Does it really matter in your life? Not really. Who cares? But as an academic, the white part is for the lymphatics and cleaning and immune. Red part is for red blood cell to just clean the worn out blood. Yes, thymus. There are many different things we know about thymus, but these are the new information about the thymus. It is quite a lot, but